Hi everybody, I'm visiting my friend Bentley. He's our newbie boy. He's at the hospital. He's in their little ISO room here. Yes, I know, I love you, Bentley. I'm waiting for the vet to talk to me. So here's the update on Grandpa Bentley. Hi, sweet boy. Hi, honey. He is, we just got him from a shelter in Coachella, California. I was gonna take this off you. Well, I'm not sure. Let's just keep it on because I don't know if the vet is gonna come in. I just didn't want him loose in the room in case the vet opens the door. So as you can hear, his breathing is not normal. And yesterday when we checked him into the hospital, he had a bunch of diagnostics done. You want to lay down in your little bed? There you go. See, I'm just gonna oh, hi honey. Here, do you want me to sit closer? You want to lay down on your little bed? So they did diagnostics yesterday, and it's complicated. So first of all, his chest. Hi, sweetie. His chest x-rays. Oh, sweetie, I love you, honey. Hi, honey. You want me to take this off? Well, if I take this off and the vet opens the door, I just don't want you to run out into the hospital because you have to stay in your little ISO room. Should we just leave it on you loose? There we go, honey. So, okay. So, hi, sweet boy. So yesterday they did chest x-rays, and they did not see pneumonia. What they saw was more concerning, unfortunately, than pneumonia. What they saw was little teeny tiny spots in the lungs, and teeny tiny spots that are generally, and he does not have a diagnosis right now, but the x-rays on his lungs showed teeny tiny spots that are consistent with when cancer starts to metastasize in the lungs from somewhere else in the body. So there's that. His blood work came back. There's some concerning things. One is there is bleeding somewhere in the body. So there's blood loss in the body somewhere, which could be cancer, could be lymphoma. So somewhere inside his body, there's abnormal blood loss. And his kidneys have signs of early kidney failure. Now, all of these things together, we're not sure how we're going to move forward. So basically right now what the vet is saying, he was not eating. Yesterday was day 4 of not eating, and he had not eaten for 3 days in the shelter. So yesterday when he checked into the hospital, they started him on appetite stimulants called Entice, and they gave him Serenia, anti-nausea, in case he wasn't wanting to eat for nausea. And today he did eat a little bit. Not a lot, but he did eat something today, so that could be the appetite stimulant. He's drinking a lot of water, a lot of water, which can go along with kidney failure. So, oh boy. So I am here at the vet right now. The vet is going to come in and talk to me. So what they are doing, they have started him on antibiotics. to treat it as if there's an infection. And if there's no infection, which, it doesn't seem like he has a respiratory illness, but if he has any sort of infection, the antibiotics have been started. Hi, sweet boy. Oh, I love you. You want me to get out of your way? Here, I'll get out of your way. Oh, you want to come up here? I had hoped, honey, you smell so bad. I wish I could bathe you. So my hope was that I was going to be able to shave him down and give him a bath. And the shave down isn't possible without sedating him. So the question is that something, I don't know. The vet's going to tell me her advice. From talking to the other vet that worked the morning shift, I got the sense that a sedation for a shave down was probably not a good idea. I know the matted hair is uncomfortable for him. It's so close to his skin in some places, it's pinching him. But, oh, sweetie, I love you. Give me kisses. But if he ends up being in kidney failure, early kidney failure, and has something like lymphoma, then I can understand the vet's hesitancy to have me to sedate him so I can do a shave down. I wanted to get him clean and comfortable. So we don't know how this is going to play out. We're just going day by day. Hi, honey. Hi, babies. There was some other concerning lab results as well, but I think that the two issues right now that is concerning to the vets is potential cancer and early kidney failure. And even one of those issues is not good. So I think we're going day by day. If by some miracle the antibiotics seem to do something and his breathing gets better, great. And his eating gets better, great. But he's just drinking so much water, which is like a kidney disease dog. Anyway, so we have a lot of decisions to make, and none are going to be made right now tonight. I think the vet said it's reasonable to keep trying with the antibiotics and supportive care for a few more days. And I don't know if we're going to end up going to either an internist for kidney failure or an oncologist for cancer. I just don't. And you know what? In the past, when we've had dogs with lymphoma, it's pretty rough. It's pretty rough. And it's painful. So anyway, I would just like to at least get him clean, because dogs, they have such a strong sense of smell. If he smells this awful to me, I can only imagine how badly it smells to him. Honey. So, hi, buddy. He loves going on walks. He's had, I heard you had 6 walks already today. 6? You had 6. He just came in from a walk when I got here. Hi, buddy. And he must be potty trained, because he's holding his potty in his little area there. He's holding his potty. Anyway, I'm disappointed. I was hoping it was going to be something easy. If it had been just pneumonia, not that pneumonia is easy, but pneumonia is generally treatable, but it doesn't seem to be either pneumonia or a respiratory infection. It seems to be something systemic. So, oh, honey. So there's the update on Bentley, and he is running up some vet bills. So if anyone is able to donate, that would be great. No donation is too small. Right, Bentley? If you can donate, please consider donating a little bit to Bentley, and you can do that at campcocker.com. When you go to donate on our website, there's a pull-down menu where you can actually pull it down and find Bentley's name. Right, Bentley? They can find your name. But actually, any donations coming in right now are going to go to him. Oh, God, I just want to shave him. I can feel he's got, like, matted hair with... Oh, I can feel, like, twigs, feces dried and crusted. He's so thin. Bentley, is it worth a sedation to get you clean and shaved? How do you feel about that? What do you think, honey? We're going to just follow the vet's advice on that, because... Whoops. Oh, you want to go back in and lay in your dog bed? All right, I'm sorry I don't have better news for you, everyone. Sometimes these senior dogs, you don't know what you're going to get till you get going on the diagnostics. So, all right. I hope you're having a good Saturday evening, everyone, and thank you for your support of Grandpa. Grandpa Bentley. Did you know that grandpas are my favorites? Bentley, did you know that you was my favorites? The grannies and the gramps are my favorites. They are. All right, have a good night.